I'm Sarah Barton. I'm a certified nurse midwife working with Rutland Women's Healthcare. As a labor and delivery nurse, I found it a bit dissatisfying to see patients only for a couple of days in their labor and delivery and postpartum experience and then not have contact with them ever again, or possibly years later when they came back for a future baby. Being in the midwifery role, I now have some continuity over time with patients to watch their families grow, to help them through the experiences that they may have between babies and each year as they continue on through the childbearing years. The biggest misconception about a midwife is that we only catch babies outside of the hospital in people's homes, and that's actually really a minute number of midwives in the United States that do that. There's actually less than 5% of midwives across the United States that catch babies outside of the hospital, and an even smaller amount that do home births. We care for people from the onset of menses, so early teens, all the way through the end of their lifespan. We can provide GYN care, we can provide prenatal care, we provide assistance in the operating rooms for our physician counterparts, and do procedures in the office and in the hospital. We catch babies and manage labor and see patients in the hospital postpartum as well. I think the biggest influence on me really has been some of my patients. When a provider or when a healthcare person stops learning from their patients and can't take something new or different away from a patient interaction, that's when it's time to hang up our hats and just move on. So when I'm not here at work, I can be found at home either cooking or outside with my animals. I have 4 dogs on our mountain. 1 is a grand pup and the other 3 live with me. Our grand pup is a German Shepherd, a very big German Shepherd who has a very loud voice and lets it be known. Then I have 3 quieter dogs, a Cocker Spaniel, a Cane Corso, which is an Italian Mastiff, who is large but sweet and quiet, and then a very busy hunting dog, a German Shorthair Pointer, who name is appropriately Blitz, because that's about what you see. Blitz this way, Blitz that way. There are 5 core values at our organization, and the one that resonates the most with me is compassion. Unexpected loss in pregnancy or a gynecological cancer. I feel like these are the times when we make the most impact. Some of these patients really just need support, education, and a quiet presence in the room, someone that they know they can turn to when they need to. And so I think being there for those patients going through some of the hardest moments in life is really what confirms that this is the right job for me.